Hello, hello, welcome. My name is Santiago Lopez. I'm here at Lumm Center, Stem Cell Center. I found this place through a really close person that is in my family. They explained to me what stem cell therapy is, and I've been on a journey of trying to find different modalities of healing and just betterment of myself and health and everything around it. I was a Marine for about 8.5 years in the military, so there was a lot of pressure on my knees and on my lower back that now has started to affect me. And the reason I came here was because I have something called a jumper's knee, and it's become like somewhat of an issue. I've already gotten an MRI, I've gone through different types of therapies, different doctors, and they said it's gonna take a lot of time to heal and everything, but that it would never be the same after. So when they spoke to me about stem cell therapy, they told me that it's gonna be even better after. That kind of flipped that little switch inside my head, and I was like, okay, let me test this out. And upon coming here has been one of the most spectacular experiences I've ever had in a health journey, because what I do, I'm a wellness UCG. What that is a content creator for wellness, different types of modalities to help you heal and better yourself. And coming here, I received it was like a family / VIP type of treatment. Like I wasn't just another patient or a different client that they're trying to get money from. Like I felt a part of this family, and it was amazing to just even do it. So it created even more excitement to continue this process. Today I got a shockwave therapy. It's where they shock the tendon to rip it a little bit more so the blood agitates. So when they do put in the stem cells go in directly to that one spot and it heals it better. We have a couple sessions that we have an appointment for, and then we'll get the stem cells. So I'm excited for this journey, and the only thing I'm worried about is that if it does work, I'm going to be spending so much more money on getting all different kinds of treatment with stem cells. So thank you, and come on down. Again, we're here. This is the place to be at. Let's go.
Okay, we are going to treat Santiago. Santiago has on his knees what we know is patellar tendinopathy. The main issue on this tendinopathy is that he has new vessels formation. He has some calcification across the tendon and partial tears in the tendon. So what we're going to do is to try to break the calcifications by the shock waves therapy, and then we are going to applicate definitely a lot of stem cells, trying to make the enhancement of the regenerative process in the tendon as well, to change the pattern of the collagen fibers that definitely are not allowed to handle the load of the tendon in the practice of the sports, the physical activity, or something like that. So definitely we have to apply a lot of physical therapy afterwards to improve the condition of the stem cells and enhance the activity of the stem cells to improve obviously the results. ¿Listo?
Okay.
Entonces pones tus daticos acá, el nombre, todo. Listo. Okay, Santi, you can lay down the stretch, please.
Okay.
Perfect. Okay, this is the place. And
And once it hits the area that is actually injured, that's where I start feeling the tear and what's actually like what he's doing. And that's when it gets really painful. But other than that, it's pretty manageable.
No cortisone shots, no anti-inflammatory medication like ibuprofen, diclofenac, or something like that, okay? At least for 3 months, okay?
If I flex, is that gonna?
No, it's better not to flex because I need to go this way and with the tendon pretty relaxed. And if you flex, the tendon becomes tight. Eso va a ser abordaje. ¿Ve?
Good thing that happened was the expectation that they gave me of the pain was very high. So once it actually did it, it really didn't feel that painful. It was just that when he pushed in the stem cells into the tendon, I felt the pressure of it like going really fast, and that's what felt uncomfortable. It's not like a pain. Like I don't want to think like it's like a sharp or like I'm getting hurt. It's such an uncomfortable feeling when I feel the stem cells go through and puncture that liquid. That just feels really weird. So it just creates like a sensation in the body of pain, quote unquote. But other than that, it was really easy, very simple, very fast. And again, the expectation was already here for the pain level. When it came down here, it's like, it was nothing. Very nice. And Dr. Alejo's a very great guy. His smile and his energy just makes you feel more like, all right, it's easy. So thank you. And I'm excited for the recovery process.
Last advice, start moving. Very important. Physical therapy, some icing in the surface, that's very important. Try to avoid high load impact exercises because we need to release the pressure in the tendon for at least maybe 2 to 3 weeks. After that, start your working out. You can go for a run, mild running, okay?
Okay.
Physical therapy is very important, okay?
Yeah.